right, welcome back everybody. Still solid 100.9 FM, and yes, we say good morning and welcome to Glaucoma on radio on solid 100.9 FM. This is your trusted platform for conversation that protect not just your voice but your vision. My name is Chibika James. Welcome everybody. And yes, today we are talking about something that many people are living with even without knowing, and that is blind spots in their vision. Blind spots in their vision, not the kind that you check in your car mirror or the kind that slowly develops in your eyes, but then the one that quietly steals part of your sight. Now, we all very much know that glaucoma is often called the silent thief of sight, and it doesn't usually start by making things blurry. Instead, it begins by affecting your sight vision, creating a small blind spot that your brain cleverly hides from you. And that is why many people would say, I can see well, even when damage has already begun. Well, this morning, our focus is blind spots you don't notice. Blind spots you don't notice. And we'll be breaking down that vision field loss. We'll be breaking down what vision field loss really means. We'll be asking the question why it goes unnoticed for so long, and also how it can affect everyday life, from working safely to driving home safely. And to guide us through this very important discussion, we have with us an expert from the Eye Specialist Hospital Tesh Enugu, Dr. Sunhaya Okeke. Good morning, ma'am, and good to have you, doc.
Good morning, Chibike and our listeners.
Okay, very, very interesting conversation we'll be having today. Blind spots that people do not notice. Let's start with understanding this blind spots and what glaucoma is all about. Let's start with something simple. Okay, what exactly visual field detect, or what we call this blind spot? Because when we talk about blind spots, there is security blind spot, there are blind spots, the one that you can see with your rear glasses in your car. But when it comes to the eyes, when it comes to glaucoma, what do we call, or what do we know as this blind spots?
Okay, before we go into discussing blind spot, let's just inform our listeners once again. Glaucoma is a disease of the eye that causes blindness, and blindness from the glaucoma, once the nerve is affected, you cannot reverse it, and that is why checking your eyes periodically is very important. And if you know glaucoma steals your sight silently until you lose your entire sight, the only way out is to have a regular eye check done. Now, coming to the topic of today, before we go into blind spots, let's talk about the visual field itself. Visual field is a space, actually, what you can see ahead of you, in front of you, up, down, left and right, and while looking at one point straight ahead. Okay. I am looking at you now, but I am still able to look at my sides, left, right, up and down. This is the space your eye is supposed to see in a normal note or circumstance. That is the visual field in which your eye is operating. Now, coming to blind spots means at some points in the disease part of glaucoma, there are some spots that appear in the space that you are looking ahead or by the sides. There is a degree to which each of these up, down, left and right go. But sometimes there are some spots that come up. These are not the ones you see as cobwebs. There are times people here come to complain. There is a black spot moving everywhere. I am moving, and my eye is moving. It is moving with me. That is not what we are talking about. Blind spots are like some patches in the space field of vision that for some reason your eye can no longer see. But what really happens is our brain is a big player in the vision. Eye alone does not do the seeing, even though from childhood we are taught eye is the organ of sight. Yes, it is, but eye does this work effectively because it liaises with the
brains.
Okay. Now the brain plays a significant role in the part of vision or seeing. Now, because the brain is a smart man, and he tries to initially when those tiny spots appear, human body, the nature has gifted us physically and otherwise physiologically a lot of compensatory mechanism. Compensatory means you are not seeing something. I'm not seeing something by the right side, but you can easily change your look. You can turn your head, turn your neck, and you begin to see.
Yeah.
And when that happens, you don't really have a feeling you are unable to see something, because at that point the compensation comes in. You can just turn your neck and see. Likewise, when you don't see something in front of you or by the side, some tiny things that are not seen very clearly, the brain sends some signals that, look, the right eye cannot be seeing something straight and right, but the left eye can easily compensate that. When the left eye doesn't see, the right eye can compensate. So there is an interplay of the two eyes, and likewise the brain also plays out. It now says, look, this is missing, but I can make it up. Brain is an AI on its own. It is seeing some areas that is deficient. Like I'm looking at your screen here, and the image in front of me is solid FM. Maybe some parts of that blue ring is missing, but brain sends signal. It maybe because of the colors, because of the background, because of the nature of the environment, because it sees solid, it has some residual information. It combines all of them and tells you this is what you are seeing. So brain is an inbuilt AI that tries to compensate what you don't really see. So the early things that you actually don't see, you miss it out because your brain is helping in the cheating process. Okay, well, it is helping compensating. Okay, so now at the early stages you tend to miss it out. You don't, because inherent to you, nature has given you compensatory mechanisms, and because of that you miss it out very easily. But as time goes on, these defects enlarge. There will be the blind spots, or the blind spots are areas you are not seeing. They will begin to become bigger. Enlarge means they are getting bigger and bigger. Then some problems come in. You are now feeling as something is missing. At that point, maybe symptoms are setting in. Now, we can actually take a picture, a photograph, for instance, put it in front of you, imagine it, that this picture that is there, maybe you can, because in glaucoma, what goes off first is the side vision or the peripheral vision. So when the peripheral vision is lost, a lot of compensatory mechanisms play out, and you seem to be missing a lot of things, because the eye is good at seeing something in front of you. You can appreciate someone's face, you can appreciate your phone screen, you can read a textbook. You sincerely don't feel that there is a problem going on with my eyes. But if you look at an image, if raindrops or something has smudged that eyes picture, you will see some patches that are there. You know, that is how the image the eye is getting the signals into your brain. You can imagine when rain falls on a photograph, how some areas gets some blurry images, some peeling off, especially the olden day ones peeled off. You will see that you can't really see, but brain helps in making out those areas that are not there. Those deficit has been made up. So what we are saying is these are the early signs of blind spot, but at some point, as the disease, if nothing is done at this stage, the blind spots will be enlarging, growing bigger and bigger. They take the form, shape and size of the areas the nerve is getting involved. The nerve has different patterns they insert into the main nerve, which is the optic nerve, and now different patterns come in and play out, and by that time your field is really going down. Okay, by that time you have a feeling you are not seeing something clearly. You, even if you don't feel it, when you are walking, your steps, you are not noticing the steps, you are bumping into objects, you walking, navigating through the crowd gets very difficult. If you are a driver, because you can drive and see things that are oncoming, you are confident taking your car, but you're a cyclist by your side, you may not see very easily, and you can easily crush them, or a pedestrian on the walking, you may not see. Sometimes you go out in the morning or in the night, you see for reason unto you, a car falls on a clear road, it falls inside the gutter. Sometimes you just don't know how accidents happen. Some cars climb their pedestals. So sometimes our eye health plays into some of these accidents that take place. If you are not seeing, you are not seeing. So you are taking your car at your own peril, because you just feel, I can't see, and I'm not going too far. But when your vision is going down, your ability to appreciate danger by the side, okay, goes down. Before you really, by the time glaucoma steals your sight in front, that is blindness. Glaucoma is not like, yes, NEPA has come to take off light, that is blindness. Yes, that is total blindness. But in the process of glaucoma, the shutdown does not come like switching off completely. The switching off comes gradually. It gives you some very subtle signs, but these signs, we cannot pick it because of the inbuilt compensatory mechanism. So what we can easily do is to go for regular examination. If you go for examinations, your doctor looks into your eye and tells you your nerve is looking okay or is suspicious. Because of this, you are subjected to do some investigations, and from the investigation you now know, yes, this is the stage type of glaucoma you are working with. So it's important to have a regular check done. If you don't do regular check, this early damages can easily be missed.
Yeah. I'm glad you have talked extensively about all of this. You have also not just helped us understand what this blind spot is all about. You have also talked about how vision loss goes unnoticed, and how the brain plays a major part in all of this. And even went as far as talking about the real life impact of untreated blind spot, talking about how it can affect us when we are driving, crossing the road, or even working. Let's talk about the symptoms. All right. Are there like any? Yes, we all know glaucoma is a silent thief of sight, but when it comes to this blind spots, are there like any warning signs at all when this blind spots start developing? And how can people test to know if they are losing part of their vision? Is there something they will have to see, and then they will say, okay, yes, it seems my vision is reducing gradually? Because just like you said, vision loss might be happening, but then the brain tells you, you know what, you're not seeing clearly. Turn your neck, you will see very well, and you will turn, you will see, say, oh, I'm seeing clearly now. So how does it any warning sign that this blind spot gives?
At the earliest stages in glaucoma, glaucoma is silent. It doesn't give you pain. It doesn't give
so
you
no
headache.
One can know.
Yes, that's why it is a silent thief. They are creeping. The problem is creeping into you gradually. At that early stage, you are not going to have any sign, no symptom. You don't have any complaint. So even when we are talking, it is only when you say, I'm not seeing clearly, you have a feeling, let me go to the doctor to know what is the problem. First, you even want to go and see the chemist if he can give you something to enhance your vision. But then what we are saying is, at the early stage, glaucoma gives you no sign, no symptom, especially the one we call the primary open angle glaucoma, which is the most prevalent form in this part of our world, and is silent all the way. By the time symptoms and sign creeps in, you are talking about hitting objects by the sides, I'm seeing halos around the light, I'm having smoky vision, damage has started setting in. So if one thing you can do for yourself, if you know you have a family history of someone who is blind, someone who has glaucoma, or people are changing eyeglass very frequently in your family, or they are short-sighted, these are individuals who are at risk of developing glaucoma. So it is good, the normal cutoff is 40 years and above for a regular eye screening. But these individuals don't need to wait till they're 40 years of age. You ought to come to the hospital early enough so that we can check into your eye. If your father is having glaucoma, your mother is having glaucoma, or your auntie, uncle, please don't wait till I reach the age of 40, please, because glaucoma tends to run in the families. Sometime you will say, it is my grandmother was blind, but it was just shortly before she died. Old age does not warrant anybody blindness. So if you have a relative that has gone blind, it is sufficient pointer. And even beyond that, everyone here is an African, and we are all blacks here. So it is important to know it's a disease that is very prevalent in the African race and more common in the Igbos. So keeping it as a regular practice to check your eye is not a bad habit. It's a very important habit that will secure your freedom to carry on in your life independent. Your independence is very important to you.
Independence, very, very important. And what kind of eye test can people use to detect this blind spots?
On a crude note, if you look at the things that you can do at home, looking at edges of objects. Are you able to see the edges of objects? Like if you have a photo frame, look at the edges. Can you see it sharply? Okay, but these things are not concrete. Okay, you can close one eye. Am I seeing? Am I seeing? By the time you are experiencing loss in vision in eye, or some diminution of vision in one eye, I can tell you signs and symptoms have set in. Is always you can't check your eye pressure yourself. You have to go to a clinic to check your eye pressure. And glaucoma is such a disease that you can even go and you can read all the chart the doctors
still there,
and you can read the 6th line or even more, what we call the supernormal vision. You can check your eye pressure and it is best of everything, and still glaucoma is creeping in.
Wow.
Okay, glaucoma is not yes, I scored everything well, therefore I don't have glaucoma. It doesn't work that way. There are glaucomas that are called the normal pressure glaucoma. Normal pressure glaucomas are precious. Your eye pressure is beautifully normal, but damage is continuing. Damage is going on. Damage is going on. So that's why, please don't try to handle glaucoma at home. It is very sinful. So that we are not here to do home strategies that can guide you through the process, but try to go to eye clinic once a year.
Once a year.
There's
this call of people who are above 40, to constantly go for eye checkup. Why is that so?
As you age, there is a natural decline in death of cells that take place with aging. There is increased risk of glaucoma developing. The optic nerve is a conglomeration of nerve cells. Okay, we call it the retinal ganglion cells. They come together to make, they are nerve cells coming from the retina and converging at the point of optic nerve. So they tend to die early, and as they die, they elicit some pathways, some mechanism through which further death is enhanced. And these pathways are exaggerated as one ages. Okay, in the case of glaucoma, those that have glaucoma or develop glaucoma, the cell death takes place early, while those that will not have, the cell death may be very minimal. So if you are not coming for checkup, we are not going to know all that. And to make it more complex, the retinal ganglion cells is not just the axons are not very small in number. They are about 1.2 million fibers per eye, so they are quite big. But by the time we make a diagnosis or symptoms have set in, about 60 to 70% of those fibers are gone. Okay, wow. So you can see you might have lost, like out of 1.2 million, you might have lost like 700, 800,000 by the time you are talking about symptoms and signs. So you now start working with very negligible amount of fibers to preserve. So if you come early, we can halt the progression, because one of the major things that can be modified easily is the eye pressure. So eye pressure is a modifiable risk factor. So if you come early, we check the pressure, and if you identify that your nerve is at a loss or damage, then there is a target pressure that will be set, and all your treatment will be aimed at taking your eye pressure towards your target pressure. You might have a target pressure of 16.
Target pressure, it differs. The target pressure differs.
Pressure is not one size. Like when you say BP is 120 over 80 or 110 to 120 over 80 is normal. But in the case of target pressure, in the case of glaucoma, we have to set the target pressure according to your own parameters we see in the eye. So you are a man of 40 years or 30 years, and then somebody of the same age at the same caliber may not have the same eye pressures. Okay, your pressure might be 16, another pressure might be 12, based on your own finding in your eye, because certain factors are key in and say this is the ideal target pressure for Mr. A or Mr. B. So it differs. So when you go to clinic and say, oh, my doctor said my target pressure, my pressure is 12 and it is within normal. No, 12 is, yes, it is within normal, but if you are a glaucoma patient, it may or may not be normal based on what we see. So your target pressure differs.
Or just, the target pressure differs instead. Well, I want you to get a little bit personal and more of a personal experience for you. I'm sure you've had to deal with a whole lot of persons, but in your experience dealing with people that have issue with eyes, especially with glaucoma, why do you think many people ignore eye checkups even when it is important?
The problem is most people come to clinic when there is a problem.
So we are not about preventing.
We are not proactive.
Okay.
Partly, maybe there are cost implications.
Are there cost implications?
Apart from when you have screening sessions that are available, okay, or usually in a year you can have 2, 3, or even up to 4 times free screening is offered, but it's not everybody who is whose ears are on the ground to know when these exercises are.
When was the last time Tesh did the free screening?
2 weeks ago,
wow.
Last month, yeah.
Interesting.
Last month, and Parkland did it, Tesh did it. A lot of centers keep doing it, so it is important to know that there are free screening available. Okay, and then when you have glaucoma patients, also facilities are there. When you go to an eye clinic, if you are a glaucoma patient and say you came with your siblings or your children, can you check their eyes? Most of the time it is done free for you. Nobody is, yes, people don't utilize the facilities. There are times we have run glaucoma family screening clinics, and it runs free and you see no patient. So if there is a problem, our attitude is an important problem, because when we wait for a problem to happen before we can take ourselves to hospital, we are not being very careful with our health.
Wow.
It is better to go to hospital when you don't have a challenge, so that if there is a challenge or you have a pointer to a challenge, then you follow it up. By that, preserving your sight is equal to preserving your freedom, especially when you grow old. Old age comes with more problems, because your children, on a normal family circumstance, your children leave home, parents are left behind, you stay alone. At some point your strength goes down, everything goes down, you need help. Now your immediate help is your 2 eyes. Even when your legs can't carry you, your eyes are seeing. At least it can tell you 1 or 2 things. Even to check your phone screen, it tells you that something is there. But the moment that sight is quenched, a lot of things happen. So it is important to imagine your future without your vision, how it will take place. And are you going to lean on another person for your sight? If it becomes that, yes, we will take it up from there. But for now, you that is young, you have the chance of preserving your sight by yourself by going for a regular eye check.
Interesting. Well, ladies and gentlemen, if you're just joining this morning, it is Glaucoma on radio on Solid 100.9 FM. And yes, in the studio with me this morning, I've got Dr. Sohaya Okeke. She is an expert from the Eye Specialist Hospital, Tesh, Enugu State, and we are discussing blind spots that you don't notice. We have tried to understand what this blind spot as well as what glaucoma is all about. We have talked about how vision loss goes unnoticed. We have also talked about the real life impact of untreated blind spot, and Doc talked about how it can affect your driving, your crossing the road, or even your working. We have talked about the symptoms and the detections, okay, and we have also look at barriers to this early detection, why people ignore eye checkups even when it's important and all of that. Now let's talk about something that I'm sure many people will be waiting to listen to, and that is the treatment and the management of this blind spot. Once this blind spot develops, can the lost vision be restored?
Good question. This is why we are talking about these problems. In glaucoma, any damage that has taken place, however small, it has taken place, any nerve damage that has taken place,
nothing can be done.
You can't reverse it.
Wow.
Okay. So at an early stage, if anything has happened, just know that reversal is not part of glaucoma for now. Though a lot of research is going on, but in our own time, in the material time, you cannot reverse what has happened. Okay. So if there are tiny blind spots and you are still not doing anything about this tiny blind spot because your brain has helped you to manage what naturally you did not know there were blind spots, tiny ones, except when it is very large. That is when your brain you begin to complain and have symptoms. Any amount that you have lost at that point is gone for good.
Wow.
Is wiped off.
Wow.
So that is the key reason we say come for regular eye check, because if there is blind spot, yes, you have that damage, but the advantage of having a regular eye check is that there will not be further damage. Okay. Once the treatment starts, we can prevent the progression of that blind spot to becoming bigger and bigger and bigger, and finally taking your entire sight. We don't need it. We can stop that. So that, and how does the doctor do it? He goes through all your investigation, and it's not one of these investigations for glaucoma. Is once you are diagnosed, it's not a one-off test. What every year you are asked to repeat your investigations and you compare from the point you took off and compare it again, and you see that your treatment is working. Therefore, whatever you saw at the beginning is still the same thing after 2, 3, 4, 5 years. But if there is changes, the doctor might switch you from this treatment. Maybe this treatment option you are doing is not working for you. Let us switch to another treatment. Or he now combines 1, 2, 3 treatment option together. You can, and even the target pressure, he has initially set it for 14 as the target pressure. Oh, this pressure is still not okay for you. We have to reduce it further and now brings it down, because whatever the doctor is aiming is let this damage not continue. So coming for checkup once, doing the test once, and oh, I have glaucoma, I don't have glaucoma, and disappearing is not the way. You have to consistently be followed. Ideally, in the outside part of the world where economy functions and the insurance functions, these tests are done every 4 months. If the disease is advanced, you do it 6 months. But because of the resources here, we advise for at least once a year, so that we know how you are progressing. The aim is, let us preserve the sight you have, so that there will be useful vision with you, which you can still carry on your daily activities.
Interesting. Preserving the sight that you have, and once any little occurrence from glaucoma happens, it cannot be reversed, but then it can be managed, correct?
Yes.
All right. Right now, ladies and gentlemen, let's open up the phone lines and take your calls. I'm sure you've got questions to ask Dr. Suhaya Okeke right here in the studio, so feel free join the conversation. The numbers to call: 0704 550 2840, 0909 771 1009, and you can also call 0902 311 1009. Hello, good morning.
Good morning.
Yes,
This
good.
is Angela.
Angela, can you speak up, Angela, please?
Okay, this is Angela from Enugu.
Angela, can you sit up?
Okay, I'm Angela from Enugu.
Good to have you, Angela.
Okay, please, I want to ask a question.
Go on, Angela.
Okay, like I'm having glaucoma and I'm blind. Then sometimes I used to see shadow. But anything that is coming close to me, I need to see it a little. But I'm not seeing.
You are not seeing. You only see shadow, but once something is very close to you, you see it a little.
Yes.
Okay, Doc? Is there any question you want to ask her to know better?
Angela,
Yes. Yes.
thank you for that question. I wouldn't know the stage of your disease, because sometimes your pressures can be very high, and we wouldn't know. There are some conditions we can't really treat from the radio station. You have to come so that we can check if there are other things. What are your pressures? Is your pressures under control, or do we need to reduce your pressure more, so that that little vision you have, can we still sustain it for you? So my advice to you is, wherever you are seeking treatment, please go back and let them know, so that they will identify the safety pressures and follow it up from there.
Okay.
All right, Angela. Thank you very much for sharing. But I don't know, Doc. At this stage where it is her, seeing only shadows, and for her to see something a little bit, it has to be very close. Is the glaucoma far into her or something like that?
It's a very, very advanced glaucoma.
Very advanced. And she sounds like someone who's too young.
Yes, glaucoma takes away your sight at any stage.
So someone who is like 5-10 years can experience all of this?
Of course, yes.
Wow.
Even a 1-year-old child.
A 1-year-old child?
A child can be born with it. There are different types.
Wow.
Okay, though it's common as you move up, but that doesn't mean that
It doesn't happen.
That's why we emphasize those that have family history of glaucoma should endeavor to go for regular checkups. It is very important.
Very, very important if you've got family history of glaucoma. Well, I also want to know about this. You talked about this management and treatment of this blind spot. In this present time, how effective is early treatment in preserving the vision?
Oh, very effective. That's the good news. Glaucoma as a disease, a lot of researchers have gone in, and a lot of modalities of treatment is in place. And if the treatment protocol is obtained and the patient is adherent to treatment follow-ups, it is, your vision is can be preserved. Your vision, your useful vision can be preserved, especially for those that come at early stage. The chance of keeping your sight is very, very high. Blindness may never be part of you.
Wow.
But that is why one ought to be proactive and let us do some checks. The earlier you come,
The better.
Your ability to keep your sight with you is very high. So that is very important.
Very important. And just before we go, ma'am, if there's one thing that you want everyone listening to us this morning to remember about these hidden blind spots, what would that be?
Please, these blind spots we have talked about today, at the early stages, it will not shout at you and tell you, I am standing in front of you. The message is quite clear. At the early stage, blind spots are hidden by your brain. Okay? Therefore, the thief has to be caught. And the thief can be caught only by the help of your doctor. And staying at home, you are not going to catch the thief.
Wow.
Please, take yourself to an eye hospital. Let an eye doctor check your eye. Just don't go and read a chart and check your
You
pressure.
read AI. I'll say my eyes is
Okay. There are several Google doctors, and there are to make matter worse now, social media has a lot of take cucumber juice, do this, do that, do that. Or Sahaba International has a lot of protocols. A lot of doctors, online doctors are available, giving you sharp vision. Please, online is online. There is a trusted scientific information we need to follow, and that is very important. The objective way of checking your eye is going for a regular eye check by a trained eye doctor. Let the trained eye doctor take a look into your eye and tell you how your health is. Follow it up from there. Google, AI, they are all there. They have come to stay with us. Let it support your knowledge, but let it not be the teacher of your life.
interesting. Well, ladies and gentlemen, just before we wrap things up, I want you all to remember this, that glaucoma does not take your vision all at once. No, it takes it bit by bit, and most importantly, it does this quietly. And the most dangerous part is that you may not even notice until it's too late. And once vision is lost from glaucoma, it cannot be restored. But if detected early, and that is why we keep having programs like this to sound the information to everyone, if detected early, it can be managed and controlled. And don't wait until you start bumping into things or struggling to see clearly. Go for regular eye checkups even when your vision feels perfectly normal. Dr. Suhaya Okeke, thank you very much, ma'am.
Thank you very much.
Oh yes, we'll do this again, same time, same station, next week Friday, 9 to 10 a.m. Do have yourself a blessed weekend.